exam where it's at and allow you to have a note card that you could utilize for the exam. Okay.
When's the exam supposed to be?
The exam is supposed to be November 30th. I know.
Crappy.
Your birthday?
No, we gotta study on Thanksgiving break.
I'm sorry.
Let's go for quizzes.
Let's go quizzes.
Quizzes.
So kind of think about that as we go through the class period. I probably am gonna send out like a survey monkey, that way you guys can feel that your responses are private, you know, because I don't want you to feel like you have to do what everybody else is doing. So I'll send out a survey monkey after class today. You can let me know what you feel, and then I'll kind of make that decision based on responses, okay? Either way, you're gonna be tested on the content. I can't eliminate any because it's really important, so. Another thing too is if you're looking for some great Quizlets as far as congenital heart defects, which we started on Monday, the child with a cardiovascular disorder, that is a great Quizlet. I did it myself. It's based on a lot of ATI and NCLEX questions. So if you're looking for one that's pretty short, it's 22 questions and it has some good stuff. So you don't have to create your own, and I don't have to create one for you, so it's less work for all of us. But it is a really good one. It also does have the live gaming option. So when I was looking that up, I'm pretty sure my kids thought I was playing games, and they're like, "Can we come to your class again?" So anyway, there's options there for different types of learners. Okay. All right, we are going to continue with the congenital heart defects here, and we talked about some on Monday. So for some of us, that's brand new information. We haven't had exposure to that. What's one thing that you can tell me that you learned from Monday as far as heart defects in general? There's 4 kinds, yep. What about signs and symptoms? Yeah, acyanotic, which is pink, okay, and cyanotic, which is blue. So that's really helpful. When we think about signs and symptoms, do you think all of those 4 different categories of heart defects are going to be about the same? Yes, which will make studying a lot easier for you. Okay. All right. So again, in your ETI book, page 1111, chapter 20, and then also exemplar 16.b, talking about congenital heart defects, okay? When we look at what we're talking about, so we started on Monday just talking about the different types of congenital defects. What's congenital again? I'm born with it, okay? Why do babies have that? Why are kids born with congenital heart defects? Genetics, yep. What else? What puts them at a higher risk? Substance abuse, yep. Infections, okay? So when we think about kids that have heart defects, one that comes to mind as far as genetics is what? Down syndrome, and we'll learn about that in another chapter, okay? So we talked a little bit about those, specifically the ones that were acyanotic, so specifically the ones that I am pink. I don't change to a purple, blue color. And those are what? Do you remember? ASD? BSD? EDA. So the abbreviations, you can bank that those are probably our acyanotic ones. We started talking about tetralogy of Fallot, okay? What is that defect? Do you remember? Combination of 4 different ones, okay? What do I look like? Sometimes cyanotic, yeah, and we'll talk more about that. And then we have obstructive or restricted, and that's coarctation of the aorta. We didn't get to that on Monday, so we'll talk about it today. But that's literally where we're constricted. Instead of a garden hose, we are a straw. And just think about how, if blood is supposed to pass back and forth, if I don't have a big enough canal to do that, what that would look like, okay? We're gonna talk about those signs and symptoms so you're able to identify those. We're gonna look at how we provide care for the patient, okay? This is specific, okay? PICU, NICU, heart hospital, you're gonna see it. So you might not see this stuff in regular practice until you do, okay? You might have a 4-year-old child walk in and mom gives you all of these things that have been going on. You know, our weight is really down. When he plays with other kids, he can't keep up. I notice him sometimes like doing this every once in a while to like rest. Are those things that would worry you if you had a kid come in the clinic for a well child check? They should, okay? And then we're also gonna talk about 2 different cardiovascular acquired disorders. What does acquired versus congenital mean? We're not born with it, we can get it. And rheumatic fever and Kawasaki disease is the 2 that we'll talk about, okay? So it's really important to know how the blood flows to the heart. And I think we got to that on Monday. It's a refresher. I don't know that anybody's like, pick me for cardiovascular diseases because I love it. It's really complex, but I will tell you, it's fixable. Okay, it's fixable and you'll see a lot of changes. So when you think about the flow of blood through the heart, I like pictures because I really need a visualization, but there's a great little mnemonic, tissue paper, my assets, okay? And it just kind of shows when we're looking at the different valves, the tricuspid, the pulmonic, mitral, and aortic. The reason that's important, not only for your anatomy test with Professor Mulliken, right? But when we are listening to babies or kids, where do we listen in order to hear these murmurs or defects, okay? So again, we come in from the right side of the body, which is not oxygenated, right? We go through the pulmonic valve up there, out to the lungs to get oxygenated, and then we come back through and the rest of the blood is dispersed from our left side to our extremities, okay? And that's gonna be really important to know when we think about listening on our kids. With that being said, the most accurate place to listen is always apical. You guys learned that with adults, okay? But why should I be auscultating in 5 different spots on kids? Depends on the defect for where it's affecting, okay? So when we look at the aortic and the pulmonic, where do you think, when I'm talking atrium and ventricles, do those 2 higher valves fall within a certain spot of the anatomy in the heart? Yeah. So aortic and pulmonic, you can guarantee those live in the atria of your heart, okay? Whereas when we get down to more of that tricuspid mitral valve, we're living in the ventricles, and that's gonna be important, okay? So another mnemonic, all people enjoy Time magazine, just something to kind of trip your memory as far as the order in which things go, okay? And we'll talk a little bit about that as we go through. Does everybody know, I mean, it sounds like a cheesy question, you're seniors, I'm assuming you know, but does everybody know what a normal heart sounds like, okay? It's the love dub, right? And in order for you to be able to identify when something doesn't sound right, you have to know what it sounds like normally. Any whooshing after that second beat? No. That's a normal love dub. It's basically talking about when your heart contracts to pump the blood and when it relaxes. That's the S1 and the S2. Okay? It also shows us places in which we're going to listen. So when you're in clinical, if you have a PEDS patient, I want you to be able to do those 5 locations there. Okay? But on adults, I want you to practice it too because you can still hear, especially on your geriatric patients who might have things like congestive heart failure or pulmonary hypertension. You're gonna hear weird noises, okay? So, with that being said, we talked about all of these congenital heart defects kind of have the same symptoms, which is great for testing, right? One of those is poor weight gain or failure to thrive, right? So instead of utilizing nutrients and metabolism to break up and absorb what we eat, now this child has to use that metabolism energy to pump blood throughout their body, okay? Murmur, are all of these, are we gonna hear them? We have cyanosis and some of them won't, but you can also have pallor or pallor. What does that mean? Pale, absolutely, okay? Some of them, with that being said, pale, and I have cold extremities. Remember when we talked about acrocyanosis in newborns and that was kind of normal? It is, right? But what if I'm 4 and I have that? Not normal, okay? When we look at jugular vein distension here, that's concerning, okay? Tachycardia, respiratory issues. So a lot of these signs and symptoms are going to be the same, okay? So today I'm gonna really be intentional about directing you to, okay, if they're all about the same, besides cyanosis, how do I know that I'm hearing coarctation or ADHD? Okay. This is the most common birth defect in babies. 50% of them will show signs and symptoms, and 50% will not. Okay. This is important because this is why we see kids at 1 year, 2 year, 3 year, 4 year, right? Every year they should have a well child check, because sometimes of these kids will not show us any symptoms within that first year. They'll be asymptomatic, okay? Then they get to preschool and kindergarten, and we start to see things like the growth fall off, energy that's not equivalent to peers, okay? We talked about causes of congenital heart defects, and that brings us to what we started talking about on Monday, okay? 2 categories, cyanotic, acyanotic, okay? Blood is always gonna flow from an area of higher pressure in the heart to an area of lower, okay? So on Monday when I was trying to describe to you why we have that right to left shunting with some of these defects, it's because we have a higher pressure in one side of the heart versus the other, okay? So gravity has to help with that. Again, a shunt is like a little bridge, an opening, a hole that allows abnormal blood flow from one side of the heart to the other, okay? All right, so let's talk about the defects we talked about on Monday. These are defects that increase pulmonary blood flow, okay? So if you're gonna have a heart defect, would you rather have one of these? Yep, because you're oxygenated, right? We're not blue, we're pink, okay? We know that the blood is recirculating through the lungs time after time after time after time, okay? Which is great. That makes us oxygenated, pink. We probably won't see a decrease in saturation. We probably won't see a respiratory issue necessarily. But what does that mean for the lungs? If I have all this blood going to the lungs, overloading that system, what could you get? Instead of just making one pass through the lungs and back out to my body, I'm constantly going there. You can have pulmonary hypertension, okay? So I want you to write that down, pulmonary hypertension. What would you look like if you had pulmonary hypertension?
Shortness of breath,
Yep,
dizziness.
yep. Fainting, we have kids that sometimes are, playing basketball on the playground and all of a sudden they have a fainting episode.